You think she's a good girl, but once you get to know her, you realize she's everything. She's crazy, she's funny, she's honest, and you'll never know what she'll do next.
We're back. We're so excited to be back. And this time I'm back with the American Chiropractor magazine, which this is almost a 50-year publication that was founded by my father. And we mail to 40,000 chiropractors across the United States and even more across the world. But we're audited for 50,000. And this is one of the chiropractors that I found here in Florida, in Naples, Florida, when I moved to Florida and I was in pain. And I searched in my phone for chiropractor in Naples, and his name came up. And because we'd met at one of the chiropractic shows that I've been to with my family with the American Chiropractor magazine. And, and even better for him, I had referenced in the messages that I knew that he worked with my brother, that he had, got some tutelage from my brother in Indiana, Dr. Richard Bush. So anyway, welcome to Dr. Josh Bell here in Naples, Florida. He's got Caliber Wellness, and welcome. I'm so glad you're here today, Josh.
Thank you so much. I'm excited.
And he's awfully busy, so we had to get in his schedule and find a time for him to get here. And I just want to thank you very much, Josh. When I was in pain, when I first moved here, you really helped me. I was going through a lot of changes when I first moved here. I've told you about the adrenal fatigue that I went through. I'm getting better from that. I told you I was taking some supplements and things like this, and I'm not drinking and I'm not drinking coffee much. So that's really helping. But I wanted to find out from Josh, what can we learn from this amazing chiropractor that they have here in Naples? I know you've had 4 clinics, right?
Mm-hmm.
Now, where were all your clinics that you had?
So, it's crazy because when I was in chiropractic school, I would see the magazine and I had no idea that the Bush family owned the biggest magazine in our profession. And I heard about your brother, Dr. Richard Bush. We had some mutual connections and learned from him some while I was in school and after school.
Well, we're both from Indiana.
And
that's another wonderful thing. That's very interesting.
He's right there in the same town, one of the biggest clinics in the world. So
Fort Wayne, Indiana.
Learned some from him. And then my journey was back and way up. If you want to start there, my grandpa actually set up hospital systems, and I didn't know what he did for work until after he retired. So he helped.
Wow, that's impressive.
He actually helped with the Statue of Liberty, redoing that, bunch of projects.
Wow.
Helped with Parkview Hospital System. Helped design
in Fort Wayne, Indiana.
In Fort Wayne. So my grandpa was super fun, super funny, great guy, outdoorsman, apparently a pretty good businessman, and he retired early. About a month into his retirement, started getting neck pain and back pain. No trauma, no accidents, no fender benders. It was from his job. So,
wow.
They say sitting for the spine's like sugar for the teeth.
Mm-hmm.
Similar to the teeth, once the spine gets bad enough, then once we hit the last 10%, we get pain. So we had access to every doctor imaginable. Went to traditional medicine, traditional physical therapy, chiropractor, acupuncture. It was too late. So he basically declined the next 37 years, couldn't do the stuff he wanted to do.
Wow.
The other side of family, my cousin, whose name's also Tracy, she was in Purdue Pharmacy School, suddenly switched to chiropractic. And I'm like, why would you do that? She's like, well, whole body, whole person approach.
Mm-hmm.
Sitting can knock something out of alignment. Once it's out of alignment, it gets fixated, accelerates arthritis. Which I'm like, that's what I'm going to do. I'm going to go be a chiropractor, help people.
And at what age was this?
I was 15 or 16 years old.
Young, very young.
Yeah. So that's what I said I want to do, and followed in her footsteps. Purdue University, get my pre-medicine degree, and then went on to Logan College of Chiropractic.
Wow, that's amazing. Missouri. That's amazing. So now I know that you are really big with corrective care, which is versus the traditional chiropractor. Can you explain that? And how does that relate to the straight chiropractor versus the mixed chiropractor?
Yeah, so in the chiropractic world, there's relief care, there's corrective care, preventive maintenance care. and exploring other chiropractors, including your brother's practice.
And I have two brothers that are chiropractors.
Oh, really?
You know, my brother, Dr. Joe Bush, is a chiropractor in Panama as well.
Oh, wow.
They're both amazing chiropractors. Dr. Joe is actually the editorial director for the American Chiropractor magazine.
Mm-hmm. So straight chiropractic is literally just...
We know chiropractic.
Chiropractic. That's it. Adjust people. It's great. Get amazing, miraculous results. Part of the problem with what we're seeing nowadays is so much tech neck, so much forward head posture, putting a lot of stress on the discs in the neck and back. And then under the spine is all the nerves. So there's thousands of other secondary symptoms you can get. When we adjust people, adjust goes right back. Adjust goes right back. So we're having to do different things due to all the stress in the world, laptops, phones.
Yeah.
And like in your brother's practice with all these compressed discs, almost everyone has one now.
Right.
It's just a matter of when you feel it. So we would like to prevent, but what we need to correct, we're doing exercises, strengthening exercises, working on people's posture, giving people things to do at home to not only feel better as fast as possible, but to permanently fix it. So kind of like orthodontics for the teeth. And I give my recommendations, and people pick and choose what they want to do from there.
Mm-hmm.
But that's the idea of corrective care, is clean up the mess, fix it, fix the structure best we can. Once people do orthodontics work, take the braces off the teeth, want to put on the retainer and maintain that progress.
So I know in your practice, you are a mixed chiropractor, which means
Mm-hmm.
the difference is being a straight chiropractor is as a chiropractor that just focuses on what? Fixing the alignment, manually adjusting. Is that correct?
Yes.
But you supply all of these other modalities in your practice, because I've been there a few times, so I know. And he's got some amazing techniques. Now, do you want to tell us at all about what you've got going on?
There's a lot going on. So we want
at Caliber Wellness, you can see it up in the corner.
You know, without some of these modalities, we can get a lot of great results. But like for myself, after I got rear-ended in an icy day in Fort Wayne, Indiana, I went to 4 other chiropractors. I did physical therapy. I took medicine. I went to the surgeon. They wanted to cut me and infuse me. But the decompression is what saved me. So we do have non-surgical spinal decompression for these disc cases. Much higher success rate than a lot of the other modalities out there, a lot of the other surgeries and infusions. We also offer blood work. So traditional medicine is great. My wife and I go every year, but something was missing from practice. So we also offer advanced blood work, a lot more in depth versus traditional medical blood work, read a lot tighter. And then we have 2 experts read that, get the results back, helping things like thyroid problems, gut issues. And it's also for people who want to be healthier. So we just collect a lot more information, and it's never cookie cutter. So that's going to work on the inner workings of our body and see what's going on with our blood, all of our systems. We have red light therapy, which
real quick, I just want to say, how can you fix gut issues in those other types of things that don't seem to have anything to do with the alignment of the spine? How can you fix those in your practice?
Yeah, so like when we're talking about the alignment of the spine, it goes out of alignment from stress. We call it the 3 T's: traumas, thoughts, toxins. So physical stress, accidents, falls, sports, fender benders. You might not feel the results till later on.
Right.
Thoughts, emotional stress. We get really stressed out, especially our upper trapezius muscle. Get tight, pulls out alignment. Toxins, we eat or breathe. So with the American diet, we're actually the sickest country on planet Earth right now. We take more medicines than all the other countries combined. So if we're not eating the right foods, everyone's biology is a little bit different and can start affecting people. So for my wife, this will be a little patient testimonial. We found out she had leaky gut. So instead of her intestine digesting her food, the gluten was creating gaps, food was leaking out. And again, our medicine, traditional medical doctor, blood works great, high five, good job. When we ran our labs, we found out she had leaky gut causing systemic inflammation and making her immune system go haywire. So her immune system was attacking her thyroid gland. So we used basically the Tom Brady diet. It's called the autoimmune protocol diet. 4 months.
Okay.
Cleaned it up. She lost 16 pounds the first 2 weeks.
Wow, all that's real amazing.
Food. And then we gave her a couple supplements. One for the gut called L-glutamine. Helps heal up the gaps in the gut. Then she had cholesterol, some other issues. So we fixed that all up. retested in 4 months. And by getting a lot of that inflammation out on the chiropractic side of things, she's really holding her adjustments great. Neck pain's gone. She's having pain shooting in her arm. She's down 68 pounds.
Now, wait a minute. So what do you think was the thing that really made this like 16 pounds, that gets my attention.
Mm-hmm.
I'm like, what did you do to her that made her lose 16 pounds?
Mm-hmm.
What did you do?
So it's called the autoimmune protocol diet. And
is this something that you have that you're supplying?
Yeah, we didn't create it.
I didn't hear about this.
So, there's like traditional American diet. And then in my opinion, up from there would be like Mediterranean, paleo, Whole30. We love those diets. The autoimmune protocol is 3 levels. She went full blown.
Wow.
So went pretty hardcore with her. And day 2, came home from work and she's like, I hate this. I'm hungry. I'm starving. Cooked her some food. She's been good ever since. So now she eats everything except for gluten. She doesn't eat any gluten or bell peppers, which she didn't like anyway. But we eliminated for a while and then added them back in and saw how she responded. And we ran the blood. She's doing great. All the other weird symptoms she's having, headaches gone, nerve symptoms gone. She just ran her first marathon back in
wow,
November.
That's amazing. Well, if you guys want any more information about the Caliber Wellness or this diet or anything else that he talks about during this podcast, please refer to the biography below this message on Facebook or on YouTube, wherever you see it, TikTok, Instagram. I'm all over the place. And so make sure you like it, subscribe to our channel. And but look for his information, look for Dr. Josh's information, and get information so that you can find out about this. And if you want to ask any questions in down below, you can ask us anything. I'll make sure that Dr. Josh sees your answer. But anyway, okay, so going on, I'm like, boy, that sparks my attention. I want to talk to you about that, Dr. Josh. Losing 16 pounds. I'm like, whoa, that's about what I need to lose.
Me too.
Okay. All right. So now wait, I know there's this high society area of Naples that you may have heard of. I'm not sure because I know my viewers are from all over. But it's called Port Royal. And this is the chiropractor of Port Royal. Will you please explain to us how you got that job and how you got that title? Please, Dr. Josh.
Yeah, we always want to help people. And I was helping out a patient and her boss works at Port Royal and I traded some
works out at Port Royal Club.
Yeah. Her boss.
Which is, you have to own a house in Port Royal to belong to this club. It's very high society, we say, in Naples. Like I would say the highest society in Naples, wouldn't you?
I believe it's the most expensive.
As a realtor, I have people calling me saying they just want to be a member of the club, so they have to get a house in Port Royal. They can't get a house in anywhere around Port Royal. It has to be in Port Royal to be even considered to be a member of the club, right?
Yep. So the boss, I won't say her name because I asked me to put her on her or not, but she's a physical therapist. She's really not super fond of chiropractic or chiropractors.
Or wasn't.
She sent her boss into my practice. We got a bunch of modalities, which we can talk about in a little bit. She liked what we did, helped her wrist, gave her an alignment, an assessment, alignment, looked at her nervous system, tested that. And she's like, you'd be a perfect fit. Do you wear scrubs? I'm like, no. She's like, perfect. Come on over. And invited me in and we took a tour.
She didn't want you wearing scrubs looking like a serviceman or what?
Scrubs, so.
In the Port Royal Club, what'd you have to wear?
I didn't wear this, which that's where my wife does this stuff. So I got invited in, and I thought for myself, I always want to learn and grow. So I figured these are some of the most successful people on planet Earth, and I want to learn from them what I can in life. And come to find out, these are some of the nicest people ever. Very family oriented.
Of course.
Just like a lot of people in Naples, very happy.
That's what I love about Naples. The people in Naples are just the best.
My mission is to serve. So, everyone puts their pants on the same way. So just I get to go and serve. And as a byproduct, I get to be around people of some really big influence, and I get to help them out so they can then go do what they need to do in life. So an interesting story there. I'm not going to go into the numbers or names, but we've got a gentleman and his wife we take care of, and they've got a multi-billion-dollar exit coming up. And the wife was having some neck pain, texted me on a Saturday. I happened to be I live really close to my practice in the middle of Naples on Pine Ridge Road. I was like, sure, we can see you. I was like, I'm in my workout clothes. I just worked out, so I'm a little sweaty, but come on over. So the wife was having some neck pain, took care of her. The husband wanted to come in, which when people think of chiropractic, they think of neck pain and back pain. It's really good at relieving that, but it's really great at helping us function optimally. And optimal, feeling great is normal, functioning great is normal. And we're really dealing with the brain and nerve system that happens to run through the spine. This guy's a smart guy. He wants to be in tip-top performance for this sale they're going through. So he had no symptoms, feels great, just want to make sure he's in tip-top shape. So he zoomed right over and got a tune-up, a little adjustment, some preventive maintenance care. So it's been a blessing, and it's very cool for me too, because it's the first time I've always worked with teams and other specialists out there in the field, neurosurgeons, physical therapists. I can't fix everything. So we're all in-house there. And they're actually in their tennis club. So rebuilding it's going to be amazing. Probably one of the best clubs in the world right there on the beach.
Sure, yeah.
I get to work with their physical therapists, their trainers, their nutritionists. Sometimes their concierge doctors. And most of them actually I'm surprised. Most of them actually drive up to our practice because we have so many more modalities.
That's amazing. Now I want to ask you on that note, a question because a lot of times, because I have been in chiropractic all my life, because my father was a chiropractor and founded this magazine. And so, I've been in chiropractic a long time. And the criticism that I hear of chiropractic, and I know the answer, but I want to hear what you have to say, is people think if they get a chiropractic adjustment, does that mean they're like locked in? They have to keep going to the chiropractor for treatment every week? Like, does that mean that they have to keep it up every week, or how often? What do you recommend?
Well, historically no, like, you don't have to go forever. Some people just want to feel better, and typically very fast people feel good. But when we're talking about like the teeth, I use a lot of teeth analogies. Why brush your teeth till they hurt? I would say your teeth, you can knock them all out and do everything you want to do. We want to get ahead of the issues. And the visits, we used to call them checks. We didn't used to call them adjustments. There's so much more stress in the world nowadays.
Right.
Which we talked about. And, most people I'm going to recommend come in like at least once a month for some kind of maintenance care, if for no reason other than to prevent and slow down arthritis, degeneration of the spine. Under the spine is all the nerves, so there's a lot of other benefits. We would take blood pressure in school, adjust each other, retake the blood pressure. There's a lot of studies on chiropractic and blood pressure and organ function. Always lower their blood pressure equal to about 2 blood pressure pills a day. So I adjusted people one time in this study in the neck. Up there, you get the brainstem, a lot of the controls for all of our blood vessels. And they followed these people for 8 weeks. It was still down after 8 weeks from one adjustment. So we want to be regulating the body best as possible. People go to the chiropractor at least once a month. New big meta data research came out a couple months ago. I always thought, like, are our patients healthier because they're working out, because of diet? They took all these factors out, and our immune system works better. According to this study, about 150 to 200% better. So
I believe
there's a lot of reasons to do it. It ends up saving people time and money, and obviously you're going to feel good. So I guess to answer your question, I think people should do some maintenance, just like your teeth,
I mean, I agree.
The gym,
I agree, but I was just wondering how you answer that. Like, does that mean that if they just come in for one thing and then you fix them, does that mean they ever have to come back again? Or
some people, when they're done. Some people don't need anything. It's pretty rare nowadays, but some people would check out and like, high five, you're good. Maybe check back in 6 months or a year or
just
whatever.
The same as a medical doctor.
Yeah. And I had a trainer recently came in from one of the gated communities, and I thought she needed a whole bunch of work. Looked her over, and she really doesn't. Like, she really didn't need anything. Worked on her foot. I adjusted her ankle and ran the piezo wave on her foot, but her spine really good, nerve system clear. So she didn't really need anything.
Okay. Now I wanted to know how did this become your passion? How did chiropractic become your passion?
Yeah, just on a mission to help people and prevent people away from drugs and surgeries if possible. And there's a time and place for that. But yeah, just going back to my grandpa, watching him have this awesome career, second house out in Colorado. Couldn't enjoy any of it. And he just got more and more pain, and he went from being really fun to eventually he's actually pretty grumpy. So
Right.
that's why I want to help people any way we can, whether it's through the work we do or outside of that. We've helped people here in Naples find dog walkers,
Right.
taking people to the grocery store. But my mission really is to help people meet more of that, extend the quality of life as long as possible. That's really the goal.
Okay, now what are some misconceptions about chiropractic? We just talked about one of them. I know that once you go to a chiropractor, you're locked in. You have to go constantly forever. What's another one that's a misconception?
I'd say like the cracking sound. People think that it's bones cracking. It's not. There's some people who don't make the popping sound at all. We have another device in our office called a pulsar machine. It's very sensitive to pressure. So we scan all the vertebrae, graphs out the misalignments, and it's got a little motor there, so we can work on people gently. It actually feels really good. Not that a manual adjustment doesn't,
right.
But
I think
none of the cracking
does.
And the cracking it's not the bones cracking. There's a little bit of gas in the joints, and it's super safe. Another misconception, strokes. There's a lot of research came out about that in the last year. We do tests for those. And
what is the misconception about strokes?
People think if you can get your neck adjusted, you can get a stroke, and the odds are so small. It's like 1 in 300 or 400 million or something like that. A lot of people with strokes are having a stroke before they come in, stroke causing their neck pain. So we do some tests, and our first job is always to do no harm. So if there's any chance of anything bad happening, we'll modify or might not even adjust people. We might do something else like decompression or the pulsar machine. So I'd say that's a misconception. Can't think of much else. There's tons of them out there.
Awesome. Well, I'm going to go ahead and share the. What?
You want a big one? Feeling better. Like, we want people feeling better. That just means we got a little bit of pressure off the nerve. We want to fix people.
Right.
So we're in that 1%.
Don't just stop when you feel better. Make sure that you
want to fix it. Yeah. So that requires some testing, some nerve system testing, potentially some x-rays or MRI, see what's going on there, and then recheck and see what happened.
Great. Okay. Well, do you have anything else to say before I read the real estate minute?
No, I mean, just use me as a resource. I don't know everything, but we're building up our professional network, and we're just on a mission to help people. Want you feeling good, live a long time, just be a resource for this community to be healthier and healthier.
I have a question.
Here we go.
Yes, sir.
This man always has questions, James. I love James for this reason.
I'm an aging ex-athlete.
Mm-hmm.
And I've got severe narrowing in my third and fourth lumbar discs.
Mm-hmm.
And I used to get a lot of adjustments,
Mm-hmm.
and then I didn't, because I was afraid that as I got that narrowing and as I got some of that degenerative stuff,
Mm-hmm.
that might be a negative.
Mm-hmm.
What's your thoughts on that?
Yeah, I would want to see on a case like that, get a full history, do an exam, do some neurological, spinal, orthopedic tests, and I want to see that imaging. Most of the time we can help, sometimes we cannot, and there's a lot of different techniques out there. So, for example, I had a person with a very inflamed disc last Tuesday, and in fact, I did a house call for this person, and I'm like, we're not doing anything today. So if I adjust you, it could flare it up and make it worse. There's a lot of different techniques. Some people a lot of chiropractors put people on their side and adjust them on their side. There's different ways to do it, and we might not do it the same way every time. For myself, when I went through my disc issue, I got rear-ended, blew out 3 of my discs, wasn't sure I was going to be able to practice anymore. For whatever reason, the chiropractic wasn't fixing me. So I switched to the computerized traction. Thank God that saved my life 8 years ago.
Wow.
And I probably wouldn't have known about it if it wasn't for her
I'd have
brother.
never-
Crazy.
And I'd have never known that you had that, because I can't tell you don't move any differently.
And like every once in a while we can't help, but most of the time we can. I got like a 86% success rate with disc issues.
That's our producer, James Henderson. James, do you have any other questions, or does that complete your?
No, that completes my.
Okay, then I'm going to do commercial real estate today in Florida, because that's what you have, is a commercial office, and so I wanted to see, let me just tell you real quick. Florida's commercial real estate market is expected to continue growing in 2025 with a positive outlook driven by economic indicators and demographic needs or trends. The state's favorable business climates, lack of state income tax, and pro-business policies attract both domestic and international investors. Florida's rapid population growth, especially in cities like Miami, Orlando, Tampa, and Fort Lauderdale, has led to an increased demand for commercial properties. Now, here, if I read to you what's going on in Southwest Florida, where we are in Naples, the Southwest Florida market is coming out of a bull market that was fueled by pandemic and insurance money. While sales volume has decreased in the retail and office sectors, industrial sales have been strong. Some say the market is normalizing and that large institutional investors are showing interest in the region. So this is really exciting. I'm telling you, right now, real estate is rocking here in Florida, especially. Has that been your impression?
Oh yeah, especially the commercial. I invest in real estate too.
Oh, you do?
Yes.
Okay. I'll make sure you have my phone number. I can be your realtor if you don't already have one. So please look for my information in the bio as well. I'd be happy to help you. But what has your experience been?
I mean, for myself, looking at office space, good luck. Like we need more. So yeah, if you're looking to buy, I would be reaching out, and yeah, it's crazy. There's not a lot of options, and just geographically, we're at the Gulf of America over here, and then you got protected lands over here. So there's only so much of it. So
yeah, how many of your clinics have been in Florida?
it's the first one.
Okay.
Yeah. So if you're looking, you might want to get on it. It's my opinion.
I want to get on it, but right now there's some great deals out there. So anyway, give me a call or give this man a call if you need some help with mobility, if you're not living the life of your dreams. And if you aren't here in Florida, contact one of us, and I've got chiropractors all over the world that can help you. Okay. So thank you so much for joining us today. And I wanted to ask you one other thing, which I always ask, which is, what if people can't afford to come to you for help? What is something they can just be doing at home? Or
yeah, I mean, the pandemic of stuff we're seeing right now is, if I go to the side, our ears should be over our shoulders. It's this. You gotta get here, and here is normal. Get up, set a timer on your phone, get up once an hour. This is the worst thing you can do. I mean, it's terrible.
looking at your phone all the time. Yeah.
Do some pec stretches, 10 of these every day. Hold the last one 10 seconds.
I just do my thing is just to do. My mom always taught me she did 20 push-ups a day, because as we get older, I mean, your first thing isn't to go to the gym anymore right now in my life. But anyway, so I've been going to the beach and doing walks, and then even on the sand, I do 30 push-ups. I do 20 like this, or 20 like this, and then 10 like this, and then the sand is rushing up from under me on the beach, so it's not so easy. And then I also do sit-ups. But I mean, so is there anything else that you'd recommend?
Yeah, I mean, one of the simple things you can do is, I am shocked how many people are deficient in vitamin D3 in Florida. So I would recommend, if you're deficient, start taking some vitamin D3. It's going to help 1/3 of all the processes in our body, boost immune system function, good for the bones, good for the brain. That's something really inexpensive you can do. But walking, if you could bottle up and put in a pill the benefits of walking.
Right, that's easy, right? So that's something I've been doing too, walking on the beach.
You want to tell them about your elbow, that machine? Our crazy
well,
machine?
my elbow's fine now, thanks to your machine. Yeah, it's great. You wanna tell them?
We have some other modalities.
This is what I came in with. When I first moved to Naples, I was a wreck. And thank goodness for this man. But go ahead, you can tell. I don't mind you talking about
some of the things that set us apart. We do something called Pedibond technique, curve correction, strengthen the muscles, ligaments, and then this piezo wave machine out of Germany. We do a test trial run. Right now, the first one's $49. Get a full exam. Give all my advice. For someone like you on the elbow, the first time, we're gonna run it on the elbow. Sound waves.
Thank goodness it helped my whole arm.
Breaks up scar tissue. Gets rid of pain. It's tissue regeneration therapy. So you're gonna bring in your own cells, some stem cells, help regenerate the tissues. If it's gonna work, it pretty much works the first time. So
yeah.
We have the only one in, as far as we know.
It just took me a couple of treatments, 2 or 3 treatments. Yeah, it really helped me.
So sometimes I combo stuff, chiropractic, the piezo wave, decompression.
Mhm.
So a lot of different tools.
I totally agree with this. I've had chiropractic my whole life since I was an infant, and I'm telling you, I see the benefits. And I've had crashes. It's not like my life has been so simple. You know, I have had crashes that keeps me going.
Mhm.
It keeps me going, because if you don't, I mean, like that's why people are walking around here like this, you know, like
Well, it's like-
this, you know, because they're not taking care of themselves, right?
That's probably the last thing I want to say is like looking around Naples and looking around the country and even the Port Royal Club. Our health is our wealth. You know, I watch these people that can't hardly walk anymore. They can't do the stuff they want to do, and that's what we want.
Mhm.
And don't wait. You know, get ahead of it.
Exactly. Well, on those words, we're going to end it. Thank you so much for coming today. Thank you, Mr. Henderson, back there behind the production equipment. And thank you for tuning in today. And we hope to see you back soon. And please hit the subscribe button so we don't miss you next time. Talk to you soon. Love you. Bye-bye.
Suffering from poor posture. Poor posture can lead to many issues in the spine. They're saying that sitting for us nowadays it's the new smoking. It's worse than smoking for us. So when we're leaning forward, puts a lot of unnatural pressure on the joints in the spine as well as the discs. Can cause our head to go forward, which can lead to misalignments, degeneration, the grandma's hump. So what's the solution? Here in our office, we'll take a look at your posture, look at muscle imbalances, look at the structure of your spine, and then come up with a plan to help correct that structure, give you things to do at home. A couple simple things you can do when you are sitting. We do want a curve in the lower back, so fit a tail. We want you to stick that tail back. You might want a lumbar support, get the shoulders back. Our ears should be over our shoulders. Computer station monitor setup is very important. And then we'll give you very specific exercises to stretch certain muscles, strengthen others. And then sometimes we'll have a little tip for you if you're sitting at home working or working in the office. Set a timer to go off once an hour. Get up, walk around, check your posture. And then if there's any misalignments in the spine, we correct those, get better motion in there so you can actually get into a better posture. But super important, bad posture is accelerating arthritis at a 5-10x rate from what I used to see 10 years ago when I started practice. So drop any questions, comments you have below.